From the Youth Science Council, this is Good Question, a podcast about science in the UAE. I'm your host, Sarah Shirbaji. Today we're talking to Dr. Alaa Galadari, a psychiatry resident at Sheikh Khalifa Medical City. Dr. Galadari holds a medical degree from United Arab Emirates University. Welcome to the show, Dr. Alaa. It's good to have you here.
Thank you, Sarah, and please call me Alaa.
Okay, got it. Could you give us an overview of what you do and what led you to where you are today?
So I'm a psychiatry resident at Sheikh Khalifa Medical City in Abu Dhabi. I'm training in the largest psychiatric facility in the country, covering the Emirates of Abu Dhabi all the way to the Saudi borders, excluding Al Ain, of course. Training in such a melting pot has enabled me to assess and treat a large variety of psychiatric cases from multiple cultures, and it's been very rewarding.
And what got you interested in psychiatry?
I'd say high school. I've always had a great love for literature, and I was a big fan of The Lord of the Rings. I was fascinated by the character of Gollum and Smeagol, and then I looked him up online, and I just wanted to understand what exactly was happening. At the time, I had no idea, and then I came across the controversial diagnosis, multiple personality disorder, later labeled a dissociative identity disorder, which was fascinating to say the least. It became the subject of my English presentation. And that sparked that initial interest. And then when I joined medical school, I'd volunteer once a week in a pediatrics clinic, and I joined the child psychiatry service, which I found very enjoyable. By then, I was utterly captivated, and I've been making short films since high school. And in medical school, I went into addiction, and I thought it's one of the challenges that some of Emirati youth do face today. And we made a short film that made it to the Cannes Film Festival. So a combination of all those things, I think I'd say the arts got me into psychiatry.
Oh, I really didn't expect to go down that route to Gollum. So is DID really the inspiration for Gollum's character?
No, I don't think it was the inspiration, but to me, the viewer,
That's what they saw.
yeah,
Yeah.
exactly.
And of course, Split recently came out, the movie.
Yes.
I think last year, and that's about DID. So a lot of conversation about DID.
I think it's I think Hollywood seems to like it. I think the cinematography is interesting, the story, the plot line. But I think growing up, I think anything that was different, I wanted to know more about.
Yeah.
I was a curious child. Yeah.
Mm. So can you tell the audience what DID is, just to give them an idea, to kind of fill them in what we're talking about?
So, dissociative identity disorder is a psychiatric condition that children or people who have faced major trauma could experience, whereas, like, as a coping mechanism, they develop different personalities. And most of the time, each personality does not know one another. So, it's very complicated, very difficult, but it is a coping mechanism to um, what would be abnormal circumstances that they've had to deal with, challenges.
Mm.
Yeah.
And so different personalities manifest at different
Yes.
times, right?
Yeah.
For certain periods of time. And have you come across a case that's a DID, or is it a very rare phenomenon?
I have not.
Oh, yeah.
To this day, I have not.
I see. Did you at any point face discouragement going into medicine or psychiatry?
I did many times, both professionally from family members, which is why I took a detour after medical school and pursued another specialty. And I did it for the wrong reasons, and it made me very unhappy. When what you believe in and what you do don't align, it's very draining. And the thing is, if you really think about it, listening to anyone's opinion, anyone's advice is inviting in a combination of their principles, values, insecurities, which don't necessarily align with your own. And I learned that the hard way. But this only it's strengthened my drive to pursue the career I wanted. And funny enough, the same people who stood in my way are proud of what I have achieved so far.
What helped you push through?
I think there's nothing more powerful than following what you have found to be your calling. And I think that's what happened. Absolutely nothing is more powerful. My passion and motivation pulled me through. And the feedback I get from my patients, that's all I need to power through.
Hmm. And what's it like to be working in your field? What does your day-to-day look like?
It's extremely rewarding. It's not for everyone, understandably. But I would say the ones who join are the inquisitive types, the ones who don't believe that patients fit in boxes, the types who don't think in black and white, and the complexity of what we deal with as part of the intrigue. It's a privilege because, unlike any other discipline, I deal with the most vulnerable and the most painful aspect of anyone's experience. So most mornings we have a meeting where seniors and juniors exchange updates about new admissions. And I'm currently posted in the outpatient clinic where I see a range of follow-up patients and new patients. It's been great.
Mm. So can I ask, when you say it's not so black and white and there's these nuances to capture in this particular field, how do you square that with the DSM? Because it seems pretty, specific in what kind of boxes you fit in this classification system. So the DSM, can you explain that, what that is to the audience?
Okay, the DSM is the American Psychiatric Association's classification of mental illnesses. It's similar to the ICD, which is the International Classification System. Like you said, it's not without its limitations. It is a controversial topic. A lot of people do have reservations on how things are done and how patients are classified. And I'd say it does serve a purpose, but it's not without limitations,
Mhm.
definitely.
Yeah. So this is where psychiatrists and psychologists derive their diagnosis
Yeah.
criterion from, right?
Yes.
Um, And so medicine has come a long way in the past 2 centuries, largely due to a more scientific approach adapted in the field. More recently, we have been seeing a similar approach in the way we study and speak about mental health. From your perspective, how far would you say we have come with understanding mental health beyond the anecdotal narratives?
We're a very young specialty, relatively speaking.
Yeah.
And I'd say we've only touched the tip of the iceberg over the past century. But we have come a long way. Mental illness has been described as far back as the days of Hippocrates, when the understanding of illnesses like depression or melancholia was understood as a fluid imbalance, namely of black bile. So the Greeks conceptualized it as an imbalance of one of the four humors: blood, phlegm, yellow, and finally black bile. And these ideas took a turn in the Middle Ages, to this day in our part of the world, where it's explained in religious terms with evil spirits and such, up to the 18th and 19th century with neuropathology. And I'll skip over darker times over the past century with frontal lobotomies to treat psychosis and the eugenic programs that were on the rise. But I'm cautiously optimistic about how far we'll go in understanding mental health with the technology today, imaging, the advancement of the basic sciences. So cautiously optimistic.
I'm curious to know how you would describe the difference between psychology and psychiatry.
The difference in what sense? In what we do?
Generally,
Or
as disciplines. So, how is it different? Why would someone become a psychiatrist as opposed to a psychologist? What kind of work experience would they have that differs between one another?
well, a fundamental difference is,
Mm,
as a psychiatrist, you'd undergo medical training. So you'd
mm,
go to medical school
mm,
and then you'd specialize in psychiatry.
mm,
Whereas psychology usually falls under the Department of the Humanities, I believe, right? So you could um, get the degree at an undergraduate level and then pursue it as a postgraduate.
mhm,
And then with psychology, I think it's much broader, right? Like you have people who go into clinical psychology who we heavily rely on, and we'd work together with our patients, and others could go into research and different parts.
mhm.
Is that your question?
Yeah, yeah, that makes sense. And perhaps therapy wise, it would be different.
Yes,
Um,
whereas we would be licensed, for example, to prescribe medication,
mhm,
psychologists would treat the same patients, but
mhm,
also with different methods, like, for example, CBT, DBT. And yeah.
So psychiatrists don't practice CBT?
Some do. Some
Mm-hmm.
do, and I'm actually. I have one of the people that I work with actually does therapy for her own patients, along with the medications that she prescribes, and I think it's made her relationship with the patients different. I think.
Do you think that requires additional training for psychiatrists? Would they have to go in additional independent training?
It definitely requires
Yeah.
additional independent training.
For listeners who don't know what CBT is cognitive behavioral therapy, and it's a type of psychotherapeutic treatment, and it helps patients understand the underlying thoughts and feelings that influence behavior. So, psychiatrists and psychologists help patients develop means by which to navigate their thoughts and feelings so as to influence their behavior in a more um, functional and beneficial manner. So, let me ask you this. Part of the struggle with understanding mental health might be attributed to its intangible nature. Could you give us a glance into the science behind mental health that can help us make better sense of it?
So I do agree with your description of the intangible nature of psychiatry, which makes it quite challenging. In a sense, it's not a tumor that can be visualized via imaging and later biopsied, or a fever that could be measured, or a broken bone easily scanned. What we do relies on our understanding of the patient's experience, the clinical interview, and the existing classification systems, both of which without limitations. Now, three features in particular make psychiatry a difficult field to study. Causes may be remote in time. So, for example, with schizophrenia, uh, some findings show absence of gliosis in areas in the brain, showing structural changes, which suggests a pathological change before or around the time of birth. And the same goes with something called synaptic pruning, which occurs usually around adolescence. And there's an excess of that in patients with schizophrenia. So you see, it's time dependent in a sense. Another aspect is one cause may have several effects. So, for example, we were talking about complications of syphilis. It could cause dementia, psychosis, depression in different patients. And then one effect having many causes. And that's where I wanted to talk about the biopsychosocial approach to mental illness,
Mhm.
taking into account those three. And I think we've discussed this after a previous question,
Mhm.
Sarah,
Yeah.
right?
Yeah. So, again, for listeners who don't know, schizophrenia is sometimes synonymously used with psychosis, but they can be a little bit independent because psychosis can manifest in different forms. So you have, of course, like schizoid personality disorder or schizoaffective disorder, I believe. So I think schizophrenia is on a spectrum. Now, what is schizophrenia? So it's a form of psychosis, and as far as I understand, you can correct me, Dr. Ella. Schizophrenia or psychosis can be characterized through hallucinations, delusions, and paranoia. Is that correct? So it may have these three different tenets.
Yes, they could, not necessarily all of them.
Not necessarily all of
Yes.
them, yeah, but
Yeah.
characterized by these three.
Yes.
And schizophrenics often experience these symptoms. And
They could have positive symptoms, which are psychotic behaviors generally not seen in healthy people, although
Mhm,
can be.
mhm,
And people with these positive symptoms may lose touch with some aspects of reality. So
mhm,
you mentioned hallucinations before, delusions, thought disorders, also movement disorders that could manifest with a movement disorder, like catatonic patients, like they could stay in one position for hours at a time.
mm,
And then you have the negative symptoms associated with the disruptions to normal emotions and behaviors. So it could include flat affect, basically reduced expression of
mm,
emotions
mm,
via facial expression or voice tone, reduced feelings of pleasure in everyday life, difficulty in beginning and sustaining activities, and reduced speaking.
mm, mm,
There's also the cognitive symptoms.
mm,
And for some patients, it's very subtle, With others, it's more severe. You'd notice changes in their memory and certain aspects of their thinking, executive functioning, like the ability to understand information and use it to make decisions. Yeah.
Mhm. And hallucinations are auditory or visual experiences in.
Could be auditory, visual, somatic as well. There are many, many different types, but most commonly auditory. Yes.
And so you see things that do not exist in reality or hear things that do not exist in reality, correct?
Yeah, which could be quite frightening and distressing, as you can imagine.
And delusions, on the other hand, are thoughts about things which are not necessarily correlated to reality.
Yes.
Is that correct?
Yes, fixed beliefs that are not easily shakeable.
Okay, I understand. So can you give me an example, just for the sake of illustrated purposes, of a case of schizophrenia? So how would you describe a patient that would come in who experiences or exhibiting symptoms that are of a schizophrenic nature? What would that look like, that form of that diagnostic interview? How long would it take you to diagnose this person? What sort of things would you find them reporting? So just to kind of give the listeners an idea on you as a psychiatrist, if you don't want to use schizophrenia, maybe you can use bipolar disorder, or if you want to use manic depression, major depression, or another disorder or illness.
Okay, so what they would all have in common, I think what's very important is a clear understanding of the timeline of these symptoms, because that really matters. For example, patients with bipolar affective disorder, they could present to us initially as a case of textbook depression. Okay, and then starting them on treatment could trigger a manic episode. So I think a clear understanding of the timeline is of utmost importance, whether it's in schizophrenia, in depression, bipolar affective disorder, OCD, anxiety. A patient with schizophrenia could come to you complaining that they're being watched, they're being followed. So they could be very anxious, very agitated, understandably so, hearing voices that tell him that he's no good, that someone's after him, someone's about to kill him. And I think one of the most terrifying experiences is when voices command you to do things, ask you to hurt yourself or hurt someone else. So it's very important, that interview that you have with the patient and then later with family members in order to help them best. So you mentioned the auditory hallucinations and the delusions as well. Is there anything in particular you'd like me to?
No, not particularly, but just wanted the listeners to kind of have an idea on what it's like for you as a psychiatrist to experience these different kinds of symptoms and how long it usually takes for you to make a diagnosis, a true diagnosis.
I think most of the people that I'm working with, and myself included, labeling someone with schizophrenia, it's not something you take very lightly. So yes, we do not rush into the diagnosis.
Right.
Yeah.
I think also it's very important to highlight a common misconception people have about schizophrenics and other people with mental disorders, that they are not likely to engage in violent behavior.
Not at all.
Rather, they are more likely to be victims of violent behavior as opposed to perpetrators themselves. So as far as I know, when I was studying psychology as an undergraduate, a very large population of people with mental illness reside in prisons simply because they are treated as perpetrators as opposed to victims of crime.
Yeah.
So there needs, obviously, I mean, you would know better about this, but movements in the West have been established in order to educate police and other people in different occupations to recognize these symptoms so as not to treat people with mental disorders in a manner that could be very destructive.
You're very right, and the evidence, like in the literature, does support that patients with psychiatric illnesses are not likely to be the ones who commit violent crimes, and this fear that people have in the community is unfounded. Okay, so we have evidence that supports this what Sarah mentioned.
Mhm.
And about educating the law enforcement and policemen and such, it's very important. I cannot emphasize just how important this is, because these are patients that I see, like as a first on call. These are the patients that get referred to me in the ER, and I think that with better educated policemen in how psychiatric symptoms manifest, I
Mm.
think they'd be able to de-escalate um, situations
Mhm.
much better,
Mm.
treat them much better, and hopefully we see them much earlier and that they do not end up in prison. There is a forensic ward at Sheikh Khalifa Medical City with a forensic psychiatrist, and he does such a great job in making sure that people who need help get that help and that they're not treated as criminals when it comes to the justice system.
Yeah, very well put. Thank you. So, it is often that we hear people in our society attribute mental illness or poor mental health to a lack of faith. Is there any relation between an individual's mental health and how religious they are?
Not in the least. But that does not mean it's not important to consider. Most of the patients I have seen have been to numerous faith healers before making it to the hospital to get the much needed care. And this includes the most educated of society. One approach I'd suggest is to engage these faith healers and religious leaders in a dialogue about mental illness, with workshops aiming to identify psychiatric illnesses and when to refer patients so that they can get the treatment they need.
Mhm. And as a society, how can we better address the stigma around mental health? And why is it important to do so?
By starting the much needed dialogue around mental illness, which you've done such a great job of starting yourselves.
Thanks.
So stigma occurs when society labels someone as tainted, less desirable. There are three elements to it: a lack of knowledge or ignorance, negative attitudes, prejudice, and then discrimination. People behaving in ways that disadvantage the stigmatized person. And you asked me about society, but I wanted to highlight another issue that I'm facing, which is with doctors from different specialities. You'll find in the literature that our patients actually get less lab tests done, less physical examinations compared to patients with organic illnesses. And I've been working on a research that addresses this in particular, especially w- with medical students, as it's a critical time, I think, in preventing such attitudes and hopefully tackling stigma head on.
And what advice would you give the younger population who is interested in pursuing medicine, psychiatry, or other scientific fields?
Follow your passion. Make sure you're pursuing your chosen field of study for the right reasons. There's a common misconception that medicine, science, technology, engineering is difficult. I disagree. Any field that sparks your curiosity will not be difficult, it'll be rewarding. Reflect on what your strengths are and build on them. And no matter what, don't stop.
Mhm. Well, at the mention of common misconceptions, I really wanted to ask you something that I often experience
Okay.
because as you know, I do psychology, but
Yeah.
I'm not a clinical psychologist. But since people hear the word psychology, immediately they say, "Can you read my mind?
Yeah.
Can
Yeah.
you psychoanalyze me?" Do you
I
get
I
these?
get that all the time.
Yeah, me too. So I thought, maybe restricted to people who come from psychology, not particularly psychiatry, because that's a bit of a different word. So I thought
Yeah.
maybe it's just us that are plagued by these questions. But
Us
it's good to
too.
hear that we share the suffering together.
Yeah.
But for the record, can you read people's minds or can you psychoanalyze anybody?
I cannot,
Oh, okay.
but yeah, sorry.
Unfortunately, yeah. So what resources would you recommend to someone who's interested to learn more about your field?
About my field, you mean?
Psychiatry, yeah. Are there any go-to books or research that you recommend people start? Maybe something like, for example, personally, I'm a huge fan of Oliver Sacks. So, he does neurology, but he does this really amazing job at capturing the humanity of psychiatry and psychology. So I recommend looking into Oliver Sacks. He has this really great movie called The Awakening, and The Awakenings, not the horror movie of the same name. And there's Robert De Niro and Robin Williams. Robin Williams plays Oliver Sacks, and it's a really amazing a movie about a disease that struck, I think, in the 1920s called encephalitis lethargica. And he develops this really humane and just phenomenal treatment using, I think, L-Dopa at the time, kind of wakes these patients up who suffered from this particular disease from a catatonic state in which they're completely vegetative and they don't move, they don't interact, and then wakes them up for, I think, a summer, and then later on they return to the state. But it's a really kind of, he delivers this message of these are human beings, we deal with them in a human manner, we develop an intimate relationship with them, and we do not look at them as a kind of a sack of vessels and cells and so on. No, these are people. These are people, and he kind of establishes this humanitarian approach to psychology, psychiatry, neurology. So I recommend Oliver Sacks. Do you have any recommendations?
I'd recommend a book called Madness Explained: Psychosis and Human Nature by Richard Bentel. I found it it was such an interesting book, very intriguing. I could not put it down.
Huge fan of Richard Bentel, actually. Yeah, huge fan of it.
I was looking for that title.
Yeah, big fan. I totally recommend Richard Bentel as well. In fact, I attended one of his. He was in a conference, I attended one of his talks. Yeah,
I would definitely. I'd be fangirling.
Yeah, he does
honestly.
a lot of work on psychosis and the environmental factors related to psychosis. I also follow him on Twitter, so you can do that as well. Anyway, I think that's our wrap. Thank you so much for being on the show, Dr. Alaa. I really enjoyed this conversation with you.
Thank you for having me.
That was Dr. Alaa Galadari, a psychiatry resident at Sheikh Khalifa Medical City. To listen to more episodes, you can find Good Question on Apple Podcasts, Stitcher, Spotify, or wherever you get your podcasts. If you have any questions, comments, or suggestions for what you'd like to see from us next, you can reach us at Good Question UAE on Instagram and Twitter, or email us at info@goodquestion.ae. Good Question is a production of the Youth Science Council and the Office of Advanced Sciences in the United Arab Emirates. Produced and directed by Hind Al-Ali and Hayat Al-Hassan. Sound designed by Gareth Chen. Saad Al-Ali is our editor. Mohammed Al-Mansouri is our digital media coordinator. And I'm Sada Shilbaji.